studied in Israel and then attended the Mount Sinai School of Medicine, graduating in 1998.
This is this button up here.
He trained in the Shomer Shabbos program at North Shore University Hospital, and after completing his training, he went back to Mount Sinai as the pediatrician in charge of well baby nurseries. Subsequently, did his own service of newborns, and then decided to do real tzedakah, and went out and opened a pediatric office in Williamsburg, where everybody has at least 10 children. He is one of the staff physicians at Camp Simcha Special, spending a few weeks each summer caring for seriously ill children with chronic medical condition as part of Chai Lifeline's summer program. He lives in Kew Gardens Hills with his family and is an outspoken proponent of immunization. Dr. Begun.
Thank you. Just want to mention a lot of these vaccine preventable diseases most people here have never seen. We happen to have two doctors here today who've probably seen most of them, including Dr. Bright, and I'm honored to have my father here, who's been a pediatrician for 50 years, and in addition to having mumps, measles, and all these wonderful diseases that we can now prevent, he's seen them and has lectured on them also. So just to start, anyone know a little Latin? Where does vaccine come from? Vaccine comes from the word cow, vaccinia, because the first vaccine in the 1700s, which was invented by Edward Jenner, was to wipe out a disease that killed 500 million people called smallpox. And of course the method that he developed, the immunization, the vaccine back then, would never pass advisory boards now. What he did was he noticed that smallpox, which is rampant throughout Europe, was killing so many people, and he noticed that the women who were milking the cows were not getting smallpox. So he realized there must be something towards that prevention of disease. So he ended up taking some of the pus from some of the pox of people, and he injected into someone, and then he saw that person didn't develop smallpox upon exposure. So that was really the first case, and that's actually the only infectious disease, whether caused by a bacteria or virus, that was completely wiped off the face of the earth, and now the vaccine immunization does not exist. I'm sure they have it culturing and frozen in labs just in case it comes back, but that's really the only infectious disease that's been completely wiped out. And I'm just going to go discuss the several bacteria and viruses that we have immunizations for now, and we routinely give our children. There is much controversy in the last few years about immunizations. In my book, there's really no controversy about whether to give them. It's a big discussion, and we'll hit on some of those topics as I discuss each of the vaccines, and at the end you can ask some questions. So these are the diseases that are caused by bacteria that we have immunizations for. Dtap, diphtheria, which is included in the Dtap immunization, which is given as newborns 2, 4, 6 months of life. We have the Haemophilus influenza, which we'll discuss in a little while, which is a major cause of meningitis. Meningococcal disease, another type of meningitis shot that we have. Pertussis, everyone knows whooping cough. Pneumococcal disease, strep pneumo, polio, which is making some headway now in the world, we'll discuss it in a minute, and tetanus. And everyone's heard of tetanus, step on a rusty nail and make sure your tetanus shot is up to date. So we're going to go through all of these bacteria, and you may see some graphic pictures. I do that for effect, just so you realize that there are very serious complications to all of these diseases, and we have to be very vigilant about protecting ourselves and our families, and especially our children from acquiring these diseases. So, how do I go back? Okay, so the first one is diphtheria. So diphtheria is caused by Corynebacterium diphtheria, which I've never seen. I'm sure my father's seen it. Starts out as an upper respiratory infection, and it becomes so severe it sort of strangles the people to death. If you look in the back of the throat there's this white pussy film that covers the back of the throat and sort of suffocates and chokes people to death. It's called a pseudomembrane on the tonsils. And the fatality rate is 5 to 10%. Children would get this 50, 60 years ago, 5 to 10% of them would die. We now have a vaccine, immunization that prevents it. Haemophilus influenza type B. This child here has a swollen face, if you notice the right side of the face, and that's due to the HIV infection. Routinely, years ago, before the Hib vaccine was invented, that was the major cause of meningitis in children. And one of the sequelae, one of the side effects of having Hib meningitis is neurological complications and hearing loss. And I know of a family in this neighborhood, they refused to vaccinate their kids, and at age 2, the kid developed Hib meningitis, and he's deaf in one ear. Then, of course, she decided to immunize the rest of her kids. But this is very serious. We pretty much wiped it out, but there are pockets where we do find it, and we have to make sure that our children get this shot. Then there's Mmr It's a pretty graphic. Here's a 4-month-old who basically probably didn't survive. This is meningococcemia, which is a very fast and rapid decline, and meningitis is very serious, and we have a vaccine to prevent it. Pertussis. If you notice, look at his eyes are all bloodshot. Pertussis is otherwise known as whooping cough, right? And we vaccinate our kids at 2, 4, 6 months against whooping cough. We even now, after women have babies in the hospital, they offer them the Pertussis shot as a booster, because it's very serious. If a mother postpartum develops whooping cough, gives it over to their child before they're able to get their 2-month immunizations, it'd be very serious. So we see that his eyes are all bloodshot from the constant cough. Violent coughing, a lot of times from the cough they break their own ribs. That's how badly they cough. We have a very safe immunization for that right now, and it's given routinely. Polio. Can I skip one?
Yeah.
Pneumococcus. So there's a shot, it's called by strep pneumo. So it was a recently developed immunization. This has decreased the amount of ear infections in children by tremendous amounts. It also has decreased the amount of serious complications from strep pneumo, which include meningitis and pneumonias. So this is a very important shot. Children should be getting minimum of 4 of them with a booster. And very important shot, prevents pneumonias, bacteremias, blood infections, meningitis, and ear infections. Polio. Dr. Bright was telling me the other day that when he was an intern, he used to see many patients with polio on heart and lung machines, could barely breathe. And even nowadays, I don't know if everyone's heard, in Israel, a few months ago, they discovered no one had a real case of polio, but there was remnants, there was evidence in the sewage that polio was making a comeback in Israel. And if anyone has children in Israel, my oldest daughter is in Israel for the year, they recommended that they get booster shots. And there was a meeting of immunization experts a few months ago, and they decided that anyone who hasn't had a booster in 10 years, which is anyone, usually the last booster for polio is about age 11. We get a shot to boost our polio. 4 to 6, I'm sorry, age 4 to 6 is the booster for polio. And so anyone over 15 has not had a shot in 10 years. So anyone who plans to visit Israel should talk to your doctor, because in Syria now, because of the strife politically and the war in Syria, there have been hundreds of cases of polio. So Syria is not so far from Israel. There's back and forth. So we have to, anyone traveling to Israel should speak to their doctor, possibly get a polio booster. Are you recommending that, Dr. Bright?
Not yet.
Not yet, okay. Okay, that's something that I just read about. And actually, there was, just in California, just the other day, there was a polio-like illness causing paralysis in kids. I think they had 30, 40 cases. They don't understand what it's from. Not from the polio virus, it's from some other virus. And I guess they'll do some bacteriologic investigations and see, what the cause of it is. And who knows, maybe that's another form that will have immunization also. Tetanus, right? Painful muscle spasms. We all get tetanus shots. It's good to get boosted every 7 to 10 years. So if you haven't, your kids, no problem. You get a tetanus shot at 2 months, 4 months, 6 months, another booster 4 to 6, another one at 11 to 12. But adults, maybe you haven't seen your doctor in a while, find out. If few years ago, I was walking through the park, I stepped on a rusty nail, went right through my shoe. I realized I didn't have my tetanus up to date, so I got another tetanus shot.
Is it okay to do it after the accident? You have to
Yeah,
do it.
yeah, yeah, but don't wait.
Oh, shoot.
So that's tetanus. Okay. So the bacterial, the immunization we have against bacteria, there's very few side effects, mostly pain at the site, maybe a low-grade fever. Not the most controversial of shots. However, now we're going to talk a little about the viruses caused by hepatitis B, hepatitis A and hepatitis B. Hepatitis A, you may think, I'll never get exposed to hepatitis A. But if you ever go to Williamsburg, Borough Park, you eat in some of these quote-unquote Heimish places, you don't know who's serving your food. There could be indigents from other countries who carry hepatitis A is rampant in Mexico and other places. So they could be bringing that, touching the food. Next thing you know, next day your eyes will come yellow. Let's look at the person with hepatitis A, a little jaundice of the eyes. And usually it's self-limited, but sometimes it could lead to chronic liver disease. Very rarely. We have a shot, we start giving the immunization against hepatitis A at age 1, and most children get 2 boosters. In this neighborhood, I don't think it's pushed that much because maybe there's not so much of an exposure, but where I practice, it's very important. We make sure every kid has 2 hepatitis A shots, but by the time they hit the age 10. Shingles. This is a rash from shingles, and we know it's a chickenpox virus. And there's actually an adult shot now to prevent shingles. And we, of course, have a varicella shot, chickenpox shot, that we give at age 1, along with the MMR. And then a combination shot between age 4 and 6 is combined with the MMR. So we give boosters of chickenpox shot. And originally, it was just one varicella shot that we would give, and then we noticed that the immunogenicity of the shot sort of wore off a little, so we added a second shot. And before pregnancy, women get tested, they check their titers, make sure they're up to date with their titers are effective, because it could be very dangerous. If a mother breaks out with chickenpox, nursing a newborn baby, it could be very serious.
Yeah, ask a question. Someone told me, wouldn't it be smarter, I don't know the answer, to have your children exposed to actual chickenpox because has lifetime immunity?
Right, that's true. There's no question that that natural disease confers better immunity than giving the shots. But you also have to remember that there are also side effects to having these diseases. Chickenpox usually is self-limited, but sometimes it could cause, serious pneumonias, pneumonitis, and encephalitis. Could be very serious. Full body infections, they can get septic and get infected pretty badly from it.
But how long is the immunity coverage,
So far, with 2 shots, it seems it's pretty good. Again, there are no studies past long-term yet, but I'm sure they'll be doing that. Okay, this is HPV, one of the common sexually transmitted diseases. I'm not sure if pediatricians are offering it to the girls.
It's a shot?
Yeah, it's a shot.
I know it's controversial, that shot in Texas or something.
It's what?
In Texas, they wouldn't give that shot.
Some states, had strong vaccine movements preventing them from giving the shots. But in New York.
No, this shot. This particular one.
Right, that's what I'm saying.
Yeah,
it's true. But most people do give it. It definitely prevents. They've done studies. There are certain serotypes of HPV 16 and 18 that are very well known to cause cervical cancer, and it's very effective in preventing it. And now they're even giving it to boys.
A girl got very, very ill from that shot, that HPV. She's completely, there's a video going around.
Yeah, well, if you look hard enough, the anti-vaccine movement can give you evidence for every single one of these shots that they lead to certain sequelae, and they argue against it. But in general, I read a story that someone brought their 2-month-old baby to the doctor, and he was waiting in the pediatrician's office to get the first set of shots, and he got so frustrated he just left. He went home, and that night the child died of SIDS. So had he been given that shot, he would have for sure blamed it on the shot. On the shots. Meanwhile, there are other things that could cause morbidity in children. and not necessarily direct result from the shot. So we're going to discuss that a little later. Influenza. Most people here give their kids flu shots. Some yes, some no. You know, hundreds of thousands of people die of the flu every year. I had a patient last year die of the flu. It was very unusual, a 9-year-old. You know what? You do your hishtadlus in terms of giving the shot. It's a very safe shot. There's an intranasal and there's an intramuscular shot. And I've been taking this shot for 25 years. I give my kids every year. I think it's a very good shot, and it, you know, on a holistic level, you know, it does definitely prevent a lot of bad disease. Flu is a very nasty bug, and it's a very good shot to give. Measles. Anyone seen measles before? So the measles, we give a shot called the MMR. It came out in 1963. It's 50 years ago. More recently, there's been a lot of controversy about the Mmr shot. Where did the controversy come from? So, a bunch of years ago in England, probably 10 years ago, a British investigator, he came up with the hypothesis that the MMR causes autism. So he did biopsies of the intestines, he took samples from the intestines, and he proved that in the kids who have autism, who got the shot, there's scientific evidence that some of the vaccine component had crossed the blood-brain barrier and affected the brains and caused them to be autistic. That made a big rush in the community. Obviously, it was published in the Lancet Journal in England and got a lot of fanfare that he published such a groundbreaking article. Then they started reproducing the studies, and they saw that nothing really panned out the way he said it. That there's been dozens and dozens of studies that have conclusively said that there's no relation between the MMR and autism. So the way I explain it is it's a temporal relationship that usually, unfortunately, when children do develop autism and PDD, usually between the ages of 1 and 3. That's when it presents. We give the MMR shot at age 1. So they see, oh, I gave the MMR at 1, and then 2 months later, 6 months later, 8 months later, a year later, their child develops autism. So they need something to blame it on. So given this you know, so-called scientific evidence, which was totally upschlugged, and even the person who did the study, his license was taken away. He was totally banned from practicing. And the problem is, though, once it's out there, and it caused waves and waves of movement, and it sort of fueled the fans of the anti-vaccine movement, and it's caused irreparable damage to children. Many children, especially in England and here. What happens? I'll just tell you an anecdote. So in Williamsburg and Brooklyn, last spring, we had the largest measles epidemic in United States history in 25 years. We had like over 100 cases of measles. 2 years prior to that, we had hundreds and hundreds of cases of mumps in Brooklyn. It was unbelievable. Never seen anything like this. What happened? There were in England, because Europe has such a strong anti-vaccine movement, and for years people were refusing the MMR shot. So as that happens over years, so more and more cases pop up, especially in England. You have unimmunized people who now get on an airplane and travel to New York, and some of them have been exposed to measles or mumps. They're on an airplane, and they come to New York, and then one of these 16-year-old boys from England, he goes to a summer camp in the Catskills, and a week and a half later, he breaks out with a case of the measles, and he spreads it to hundreds of kids. Now, you may say, well, all these kids should have been immunized. So there's a concept called herd immunity. Herd immunity is when everyone in the group, if everyone in this room was immunized against, let's say there are 100 people in this room, so everyone's immunized against measles, mumps, and rubella. So for measles, the penetration, the effectiveness of the shot is extraordinarily high. It's in the upper 90s. So when we don't have an active case in the community, so we're all nicely protected. And even if one case would be introduced, over 95% protection rate for the measles. So we're good. That's why in the latest epidemic, a few months ago, the only people who got the measles were people who didn't have the shot. Either they were too young to have the shot, they were under a year, or they were delaying the shot, which is very common. I don't want to give it at age 1, I want to wait till 15 months, I want to wait till 2 years, 3 years. So we see from the MMR, the measles aspect of it, almost 100% protective. Now the mumps, unfortunately, is only between 80 and 85% protective. So when an active case of mumps comes into a community, so if there's 100 people in this room, 15 people will not be protected. So that's why the mumps, we had hundreds of cases of mumps. But the people who have had the shot, it did have somewhat of a protective effect because it did help lessen the effects of the disease. They didn't get as severe sequelae. One of the sequelae of mumps in boys and girls it could be infertility. It's a very serious thing. So that's just like a brief history of the anti-vaccine movement in terms specifically for the MMR. And I instituted a rule in my practice that beyond 15 months, if you don't give your kid the MMR, it's not fair to the other people in the practice. Why? Because you have a child, let's say, under 1 year of age, so you can't give the MMR yet. We start at 1 year of age. Someone comes in with a 2-year-old febrile child who is now carrying the measles, he's putting your child at severe risk. So why should we take that risk and have your child be part of the practice when it could be potential vector of infection for people who plan to give the shot? Or there are people also who are immunocompromised under treatment for malignancies that have wiped their immune system clear and they can't get the shot. So those are the people who rely on what we call herd immunity, everyone else in the community having the shot to confer an extra level of protection on them.
What happened to those children that had the mumps and measles? Were y'all able to help them?
Just basically watch and wait. I mean, one mother had a miscarriage from it, from our community. Some kids got really sick from it. And the ones under a year, we could not give the shot even right after, so we have to give something called the immunoglobulin, which is a very strong immune shot to help prevent it. So we ended up giving like 10 or 12 kids. Because at one point we had a 2-year-old in our waiting room who had a high fever but didn't have a rash. So he was there on a Friday, and he exposed 40 people, in my waiting room. Then Motzei Shabbos we get a call. He now has a rash head to toe, classic measles. So we had to go call back every person in the office, and anyone who hadn't had an MMR, we gave it if they're over a year. If they had one and they're not 4 yet, we gave the second one right away. And those under a year who we couldn't give the MMR, we had to give the immunoglobulin shot, which we had to get directly from the health department because no one cares. So it's a very serious thing and very important. And you think that, in today's day and age, there's no measles. There's plenty there was a case of measles in Orange County. I just got an email today about it. They're popping up all over the place. I had a friend who was on a plane once with their baby and was sitting next to someone from Israel coming to New York. And a week later, she got a call from El Al saying that the person sitting next to them, their child developed the measles 2 days after getting off the plane. So technically, that baby was contagious from before and had exposed a newborn. So that newborn ended up getting an immunoglobulin shot too. So it's not like you're making a decision to give shots for your own child. There's a community-wide decision you're making. You want to be part of the community. If you want to reap the benefits of the herd immunity of being protected. So you say, well, let everyone else get immunized. I don't have to put my child at even a 0.001% risk of having a complication from the shot. Well, that's not fair, and that doesn't work. So that's the measles. That's what it looks like. Hopefully you'll never see that. Yeah?
When, 30, 40 years ago, when people had measles, maybe I'm wrong, but I don't think they were nervous about it. I know there's a Brady Bunch episode where they all had the measles, and no one was concerned. They weren't afraid of dying, So why is it now? And obviously there were no vaccines for then. So
right.
Why now is it all said and done?
Well, now that we have the technology to immunize and prevent it, there are complications to these diseases. I was saying before that with the mumps, you can become sterile, infertile. Do you want to take that risk for your child? People died of the measles and the mumps every year. And before the vaccine, there were thousands of kids who died in America.
Same as like the chickenpox? I mean,
Probably worse than chickenpox.
yeah.
There are more complications in measles and mumps than chickenpox. So I mean, if you want to take that risk for your child, that I think that's a little crazy.
Yeah, but I mean, there's also risk with the vaccine, you know? And a lot of that, like the chickenpox vaccine hasn't been around long enough to,
Correct.
you know, and when kids have illnesses or learning disabilities or things like that, you know, we can't say either way whether it's from the
Yeah, they've done
vaccine or not.
studies. They have done studies of kids with autism who've had the MMR and who've not had the MMR. That's how they debunked that whole theory from England. And they show there's no increased risk of having children with learning disabilities or autism, but people who have gotten the MMR or haven't gotten the MMR. It's the same percentage. There's no increased risk there. Yes.
When you have the chickenpox, doesn't this shingles virus stay with you forever? And then when you get older?
Yeah, it remains latent in your spinal column, and they actually have, I don't know about the adults, but they have now a shot for shingles. Dr. Bright could
I'll
speak.
talk about that
Yeah.
later.
Yes?
Yeah, I grew up in a small town. I had measles. I remember I might have been 5 or 6 years old. I had 105 or more fever. They were concerned. They put me in the hospital.
Sure.
And when I broke out in the rash, they took me out. The health department at that time posted signs outside my parents' door. They were not allowed, nobody was allowed to come in or to go out, but they were worried about blindness. I remember being in a dark room and affecting the hearing, I believe,
Hearing,
as
yeah.
well. So it was a pretty
Right.
serious
Look,
situation.
for most people, it's a self-limited viral illness. But for a percentage of people, it could be deadly. So we have a perfectly safe vaccine. You know, you make the decision. I mean,
But what I understand at this point, that there were some questions about giving multiple vaccines in one injection. And there was discussion about whether they should be given
Separately.
single vaccines or should.
well, they did. Look, any vaccine that's on the market now has gone through exhaustive testing in hundreds of thousands of kids. So originally, the MMR was 3 separate shots. You had a measles, you had a mumps, you had a rubella. But they tried to find a way to combine it, and once they had the scientific, bacteriologic technology to be able to put these antigens together, so they saw that by giving the combination shot, it didn't have any more side effects, and it conferred the same immunity. So they came up with a shot.
Didn't DPT come up with an additional?
Right, so there's the DTP was Diphtheria, Tetanus, Pertussis.
Plus, I thought there was an additional.
Now they make an acellular pertussis, which has less. So the pertussis part was known to cause the most fever and side effects from that shot. So more recently they came up with an acellular pertussis, which has far less side effects. Again, they're constantly perfecting the shots. Now so one of the arguments is, well, okay, so you don't want to give too many shots at one visit. That's fine. So you could break it up. You just have to come more frequently. Like I have patients that say, I only want 1 shot. So the first visit we'll give 1, you come back at 3 months, we'll give another. Just takes longer, but they get it done if that's their preference. You have to, But most patients, they just say, just give them all 3 shots at once and finished.
Is there a danger if you don't make it back exactly on time and you end up giving the shot, let's say 6 months later than you're supposed to?
The shots were made, at least the ones that we give below, in the first year of life, they have better immunogenicity, they work better, they give better immunity if you give it 2 months, 4 months, 6 months. That's optimal. Yeah, to delay it a week, a month, I don't think it's a big deal.
Is there ever a time where a pediatrician would say, you missed it, the window's all, it's...
Well, so there are certain instances where on some of the booster shots, like with the Hib and the Prevnar, if you only give 1 or 2, so after a year you can only give 1 more. So you only get 3. Is 3 is better than 2 is better than 1, 4 or 5 is probably your best.
giving hepatitis B in the nursery before.
Right, so they get, so they do give hepatitis B right away, and then they give 2 other ones, 2 months later and then 6 months later. But I prefer to give it in the office, not in the hospital. Doesn't make a difference.
They should give the RSV shot early also to prevent for
The
pregnancy.
RSV shot is really only for premature babies.
Right, but I'm saying that a premature baby should get it before they leave the hospital, shouldn't
Most do.
they? They
Most
do?
do.
Okay, so
Yeah,
it's not all-
most do.
okay,
They
that's-
should.
They should, they don't.
Right. Okay, the mumps, this is the mumps part of the, so you see they get that parotid gland swelling, and I saw plenty of that. Rubella, congenital rubella syndrome, very serious. We give, very important for women who are having babies to have be up to date with the rubella titers. Or else you get what we call congenital rubella syndrome, which you can see actually those eyes, those are cataracts. One of the complications of congenital rubella syndrome. I can't say I've ever seen it, but it does happen. And the rotavirus, which is a newer oral vaccine, right? Originally they had the only oral vaccine was the polio, and they realized that the polio, the live oral polio, was causing more cases of polio than they were comfortable with, so they changed it now to a dead vaccine. But they came out with the rotavirus, which is a very common cause of severe diarrhea in babies, and it caused hundreds of thousands of hospitalizations a year. Now they have a very safe oral vaccine, give it at 2 months and 4 months. There's a 3-dose version of it also, and it prevents the data, that the amount of hospitalization and deaths that is prevented is very, very convincing. There was some concern with it, as Aaron could tell you, with intussusception, which is a condition of the bowel getting stuck together. But they basically took it off the market for a little while, and then they redid it, and then they said that there's no problem with that.
Is your test to check if the kid has rotavirus?
There are assays, yes.
Yeah.
Yeah. Mhm. Yeah. Chickenpox we discussed a little. And complications from chickenpox. When you get these pox lesions, they can present all over the body. You can get infections from it and become very sick from it. And that's why we give the varicella.
Scar. It's scar too.
Right, scar also.
I thought it was harmless. Most of us had it.
Right, most of us have it. Right. But there are complications from it.
Are there some people who can escape childhood without ever getting it?
Mhm.
And then they are in so much pain when they're adults.
Yeah, if you get it as an adult, it's not bad.
Seminary, oh my God, she was 25, she was in such bad shape. Out for weeks.
So basically, these are the major ones that, you have to do your research. Don't be fooled by all the literature that's on the internet about immunizations, because most of it, 99% of it's based on false data, and it's politically oriented. And, shots are extraordinarily safe. I gave all 5 of my kids every recommended shot. No one had any, effect from it, except that it prevented a lot of disease and gave them immunity.
I have a true story about chickenpox and immunity. My son was, when he was very little, had a benign tumor. He was in the hospital. Before he got diagnosed with a benign tumor, they gave him the chickenpox shot. And there was an epidemic in the hospital, a little bit of chickenpox, and he didn't get it because he got his shot before he was discovered that he was sick. So it's safe.
They work. They work.
That's
They
what I'm
work.
saying. It works.
They work. For those people who like to, get natural disease, so they have chickenpox parties all over the place, right? If people have a live case, all people who don't want to give the varicella, so they'll put their kid in the little play group, and they'll pretty sure catch it. It's pretty contagious, just like measles. Measles, if you're in the same room, someone coughs, the other end of the room, you'll come down with the measles.
Is there any advantage to putting your child in that as opposed to?
No, I'm just saying that the immunity from the actual disease obviously is the best immunity. Do you want to take a risk with your child? That's up to you. That's up to you. Yes.
So I had the chickenpox when I was a kid, and then I had shingles when I was an adult.
Mhm.
I mean, it kind of hurt. I mean, it was,
Painful. And now you get a shingle shot, right? At what age do they start giving it?
60.
60.
Yeah.
Okay.
Thank you so much.